Part of the strategy to slow the spread of the coronavirus in Boston has been the increase in testing. It's a way to break the cycle of new infections, but also to bridge a racial disparity in health and access to care. That's why the Boston Public Health Commission has provided testing and contact tracing in partnership with community health centers. To tell us about the efforts with the Whittier Street Health Center in Roxbury is its president and CEO, Frederica Williams. Thank you very much for joining us, Frederica.
Thank you.
Frederica, even before this testing started, what can you tell us about the neighborhood and the health needs that showed you this testing was really needed?
The neighborhoods that we serve, primarily Roxbury, Dorchester, Mattapan, the low-income minority communities, have historically had the high rates of chronic diseases and low access to health care. When you look at the average life expectancy, there was a study performed by the Boston University School of Public Health that showed that the average life expectancy of people living in Roxbury is 59.5 years. And that is due to a variety of things. So we've had a long-standing partnership with the community. We provide clinic visits in both of our clinics, but we're very active in the community. And what is most important is we hire people from the community. So whether we are working in a public housing, we hire public housing residents that we call social health coordinators. Studies have shown that by having active, culturally competent community outreach in the community, meeting people where they are, removing any barriers to care, has the impact of improving health outcome, reducing unnecessary use of emergency rooms, empowering people to be engaged in care. So whether we're looking at infectious diseases, diabetes, cardiovascular diseases, we've been very active in the community. So we already had a structure before the pandemic that allowed us to be able to pivot quickly once this pandemic broke in February, March.
And I think even before the pandemic, if I'm not mistaken, more than 90% of your patients were people of low income, and more than a third did not have health insurance.
Exactly. So, and it's a powerful statement for community health centers to say, we will provide care to you regardless of your financial status, regardless of your insurance status, regardless of your religion, race, ethnicity, sexual orientation. 36% of our patients do not have insurance, and 92% of our patients live below the federal poverty level. So but also we believe that all of our patients must be treated with dignity and respect, care that is compassionate, care that is empowering, care that has the potential to improve their health outcomes. So we've been a trusted partner. People know Whittier, people come to us, people bring us into their homes because they know they can trust the work that we're doing, and they can trust that we're working in their best interest.
Well, with this particular round of testing, you didn't just make an announcement that free testing was available and wait for people to come to your main office. You went out into the neighborhood. So what exactly did that mean?
Yeah, so when we first started, part of what we wanted to do is we knew that there were all kinds of worries, and quite rightly so, about the pandemic and the impact on minority, brown and Black communities. So we knew it was our responsibility to set up testing on site. So, and we expanded the testing. So we started that in April, and the reason we could not start doing the community testing, which is what we wanted to do to prevent the community spread, is we had to wait to be credentialed by the Department of Public Health. As soon as that happened on June 1st, we started doing mobile testing, working in partnership with the city, working in partnership with the Boston Public Health Commission, working in partnership with the mayor's office to identify those hotspots, because they have the data, and we also know where those hotspots are. We're going to halfway houses, we're going to public housing, we're going to elderly homes, we're going to Nubian Square, right there where there is a lot of homeless population. We're going to Millennia Cast Boulevard, because we know that as much as all of us were sheltering in place, for those who were sheltering in place, they needed a trusted partner to meet them where they are, educate them, have community outreach workers encourage them and empower them to access the care and not just participate in testing, teaching them how to stay safe beyond the testing. So we did that, but also if you, people who are homeless, they're out on the street. So we needed to make sure they're protected. Essential workers were going to shopping centers. They had to, all of a sudden, their status was elevated as essential workers and they had to continue working. People who cannot socially distance because of their housing structure. So the city, we were able to test people, educate them, work in partnership with the city. For those who needed to be quarantined, the city set up a place at the convention center. So it's been a wonderful partnership, but again, it's because we've had the structure in place that we're able to do that. And in a short period of time, we've done about 6,000 tests on 5,000 people. And we've helped, and we're seeing when we started testing in April, there were huge gaps in testing as far as the number of people in the communities that we serve that were having access to testing. And now we've seen that the testing rates have increased significantly. And we believe that it's because of the coordinated efforts of providing on-site testing and meeting people where they are, but providing it in a way that is safe, respectful, and culturally sensitive.
Is there anything you can tell me about the test results as far as how many people were testing positive?
I would say when we first started, the positive rates for the African American and Black population was high in April. The first few weeks we started, more than 50% of the people who tested, the Blacks who tested, were testing positive. And we're slowly seeing that number go down. We saw a slight increase immediately after the protest. So we also focused our testing around educating people about how they can protest safely. So, you know, at any way you look at it, the African Americans were testing at a higher rate, and then the second highest were the Latinos. Another thing that we saw is, which we know, which is why we open testing to people regardless of their ability to pay for care, is a lot of people that came from other neighborhoods, because we opened it up to anyone in Boston. People were even coming to us from the suburbs, but anyone in Boston. 50% of the people that came to us out of a catchment area did not have a relationship with a primary care provider. So for us, it's not just providing the test and teaching them how to stay safe, it's also connecting them to care. So if we saw somebody from Chelsea and connected them to care at Whittier, we know they will not be able to sustain that relationship because of transportation. So we would look for locations close to them that we could connect them to care, because that is critical beyond the pandemic. A lot of people that were testing positive also had underlying health conditions, obesity, diabetes, hypertension. So we continued to provide medical care because we knew that while age and race was a risk factor, but having those underlying health condition was also a major risk factor.
Well, if you found somebody who tests positive, I guess the next thing is to think about their contacts, their needs for isolation. Could those be taken care of well enough?
Yes. So another thing that we were working on is in partnership with the Department of Public Health. We have a team of about 14 contact tracers. So DPH and the state, the Commonwealth of Massachusetts, partnered with community health centers because they know we have the understanding of the community and are trusted partners. So through the contact tracers, we're able to, our team of community health workers are able to connect with people who tested positive, trace all their relationships, connect them to care, in making sure those who were at risk because they were exposed to someone who tested positive we're also linked to testing.
We should mention that if the testing is still available, is there any way people can get more information about that and anything else you're doing at the health center?
Yes. So we have the mobile testing schedule is on our website, wshc.org. And the on-site testing is open Monday to Saturday, because we know people have to work. So we're open on Saturdays for them to get tested. And if there's a community organization who would like a mobile van to come out to their community to test, they can call us at 617-427-1000 and ask for Dr. Cyril UBM. He's the one responsible for testing, doing the mobile testing. I would add that we launched this mobile program in 2018 when we saw the high rates of the opioid epidemic and the impact in the community and infectious diseases. So we've been out there testing for HIV, screening people for substance abuse, mental health, and connecting them to care. Another critical piece of the testing, what we continue to do is, in addition to testing, we also continue to provide medical care. We're seeing high rates in substance abuse. So our substance abuse team and mental health team, a lot of anxiety, especially around the social unrest, that is added to the pandemic. But in addition, it's connecting people to social services. People are still hungry. We have a food pantry. So when we're out screening people, helping them to apply for health insurance, we're also connecting them to the care that they need so that they can continue to stay healthy during the pandemic and after the pandemic.